Well, the Cabinet Office Minister and Chancellor of the Duchy of Lancaster, Steve Barclay, is with us now. Hello, good morning. Thank you for joining us. I suppose you want to start with an apology to the British public.
We moved quickly in response to the vaccine. Obviously, this report has just come out, so we want to look at it and consider it. That's why we've also got an inquiry to ensure that where there are lessons to learn, we do so. But we followed throughout the scientific advice. We got the vaccine deployed extremely quickly. We protected our NHS from the surge of cases. But of course, if there are lessons to learn, we're keen to do so.
Keen to start with an apology, though, I would have thought.
Well, no, we followed the scientific advice. We protected,
so no apology?
We followed the scientific advice. We protected the NHS. We took the decisions based on the evidence before us. But of course, we've always said, with something so unprecedented as the pandemic, there will be lessons to learn. We're keen to learn them. That's why we've committed to an inquiry. And that will be the opportunity to look at what could be done differently and what lessons we take into the future.
20,000 lives needlessly lost because you didn't lock down a week earlier and you don't want to apologise?
Well, the issue of the timing of the lockdown was based on the evidence and the scientific advice at the time. The concern was if we'd locked down too soon, there wouldn't be a willingness to lock down for a long period of time. Now, we actually know now that actually there was a willingness of the British public to lock down for far longer than we envisaged, but that reflects the unprecedented nature of the COVID pandemic, the fact that we know with hindsight different things to what we knew at the time. But it's right, Kay, that we look in the inquiry at what lessons there are to learn and ensure that we learn from them.
No apology that we were told by the then Health Secretary that there was a protective ring around care homes, and we know that that not to be the case.
Well, the decisions were taken on the evidence and the scientific advice at the time. They were taken to protect the NHS. The understanding of issues such as asymptomatic infection and how that spread the disease, we now know far more about that than we did in 2020 at the start of the pandemic. So I think the question for the inquiry will be, what information did the government have on something that was unprecedented? Were the decisions informed by the science at the time? And do we now know different things about the pandemic to what we knew in February in 2020? And of course, we've learned a huge amount, but we did take decisions to move quickly. That is why the vaccine was deployed at pace. That was a success that the report recognises. But this report only obviously came out at midnight. I'm very keen to read it, but we're going to have an inquiry to look at the lessons to take forward to the future.
You just took at face value what the scientists said and didn't challenge them?
No, I think there was rigorous debate within government with science, but of course it was unprecedented. So it was a developing picture for the scientists themselves. There were areas where I think the government has received credit for moving very quickly, such as with the vaccine deployment. We also moved very quickly to protect the NHS. We all recall the scenes in Italy where its health service came under massive strain, and we were very keen to avoid our own... For reasons we were very keen to avoid that happening to our NHS.
So
but of course, it was an unprecedented pandemic, Kay. We were learning about it as we went through. And of course, with hindsight, there's things we know about it now that we didn't know at the time. But we'll look at the report from the Health Select Committee and see what lessons can be taken forward.
I suppose my viewers this morning will find it difficult to comprehend that you sent care home residents back to their care homes from hospital when you knew that they had COVID and you didn't test care home workers.
Well, as I say, we're going to have an inquiry to look at the lessons.
But do you accept that
the principal
is shocking?
concern, the principal concern at the time was around the surge of patients on the NHS, the concern around delayed discharge and how that would block up the capacity of the NHS. The understanding around asymptomatic infection was very different. We didn't have the testing regime that we now have. That had to be built from a standing start. So, of course, Kay, there are going to be lessons to learn. That's why we've committed to an inquiry. But the government took decisions at the time based on the scientific advice it received. But those scientists themselves were operating in a very new environment where they themselves were learning about the pandemic.
I don't understand why you don't want to apologise.
Well, there are lessons to learn, but the point is that we took decisions based on the science. We protected the NHS. We got the vaccine deployed at pace, but we accept where there are lessons to be learned, we're keen to do so.
Yeah, but you're representing the government this morning, and there were 20,000 unnecessary deaths in the United Kingdom, many of them elderly people, and you don't want to apologise.
Well, what I'm saying, Kay, is did we take decisions based on the scientific evidence we were protecting?
Why don't you just say, we're sorry?
Did we save lives through deploying the vaccine at pace far quicker than many comparable countries? Did we protect the NHS from the surge that had overwhelmed other health systems? Yes, we did. Now, were there consequences to those decisions? And what was the scientific advice we received? And did we make the right decisions? These are legitimate questions for the inquiry to get into. The report you're talking about came out at midnight. I've not had an opportunity to read it. I'm keen to do so. But this is why we have committed to an inquiry, so we can get the lessons
But
from
on
the
that
pandemic.
one fact, 20,000 needless deaths, according to the report, you don't need to go through the whole, hefty report in order to know that it says that 20,000 people died needlessly, many of them elderly and infirm. Are you not sorry about that?
Well, this is why we're taking decisions, for example, around
Why can't
social
you just
care
say, yes,
patients.
we are sorry?
Well, there will be lessons, and of course, where there's lessons, we're keen to take that on board. The question you're asking is, in February, March of 2020, did we make logical decisions based on the advice we received? And the knowledge we had at that point on things like asymptomatic infections was very different to what we know now. Now, we've taken on board those lessons. That's why, for example, we've said that people need to be vaccinated if they're working in social care. It's why throughout the pandemic we had funding packages of support, such as the infection prevention control that went into social care. It's why, for example, we applied 11,000 iPads so we could get better data on exactly what was happening within the social care sector. But the fundamental point within your question is, are there lessons for us to learn from what happened at the pandemic?
That's not
and the
my
answer
question.
to that is we will learn the lessons.
Minister, that's not my question, with respect. What I'm saying is that 20,000 families watching this morning probably lost a loved one. They couldn't go to the funerals because either they weren't allowed at all, or there was an extended family and they couldn't all go. We saw a young man who was lowered into the ground and his family couldn't be there and they had to watch it on Zoom. 20,000 times that happened needlessly. How can you not say you're sorry?
Well, that is heartbreaking. That impact on families, that impact in terms of people's funerals is heartbreaking. And I think all of us feel that. All of us have friends and neighbours who were in that situation. I think in terms of the decisions that the government take, which is what this report is referring to, there were decisions we took on the vaccines to protect the NHS based on the knowledge we had at that point, which were logical decisions for the government to take. But we're keen to learn from that period. It was an unprecedented time. We were working with imperfect information, and it's important we take those inquiries, and that's why we've got an inquiry to look at that.
And was it logical to spend £37 billion on a test and trace system that didn't work?
Well, just a minute ago, you were saying that we should have done more to understand asymmetric testing. That will no doubt be one of the factors in terms of what happened in social care, because it was the asymptomatic infections that played such a big part in the fatalities that we saw in the social care sector. That is exactly why, from a standing start, we built a test and taste capacity. Obviously, that took a huge amount of effort and
money,
cost.
£37
Indeed, it did.
billion.
A huge amount of cost.
And
but
the
on the
report
one
is
hand,
saying it was pointless. It wasn't fit for purpose. Are they just basically, coming up with this report with 20/20 hindsight, and it's easy for them to say?
Well, firstly, I haven't had a chance. The report came out at midnight, so I've not had a chance to read it, so obviously I will need to do so. Secondly, I think if you speak to the leading medical advice in our country, they will not say that test and trace was pointless. In fact, they will say it's a key part of our armoury.
Not what the
in
reports
terms
say,
of,
which is what I'm putting to you this morning.
I'm saying if you speak to the chief medical officer, if you speak to the leading medics within our country, they will not say that test and trace is pointless. They will say it is an important part of the UK's controls against a repeat of what happened in our care homes. So you can't, on the one hand, say that we were wrong not to have controls around people going into care homes, and on the same time say that we were wrong to put in controls.
I'm not saying it, Minister. This is what the report is saying.
Now, I'm just pointing to
pointing
to the contradiction in the question between, on the one hand, saying it's wrong to have
So
controls
you're saying
into
that the
care homes.
report is benefiting from 2020 hindsight?
Well, the report came out at midnight. I've not had a chance to read it.
No, but you knew you were on the telly
obviously
this morning, so I'm sure that your aides have pointed out the highlights for you.
So, well, I'm keen to read it, and we will engage with it, and the inquiry, I'm sure, will consider the points that are in it. What you're saying is that the report thinks that test and trace is pointless. That is not
No,
the
what
view.
they said was it was £37 billion was a waste.
But it was hugely expensive, and as a former Treasury Minister, I absolutely recognise it was very expensive. But value for money at a time of national crisis changes, and we were doing everything we could in order to put in controls so we could better protect people and learn from the early lessons of the pandemic.
OK, let's move on to Brexit, should we? An area that you know an awful lot about. The EU, it would appear, actually giving in and offering up some changes that they say they have been working on for some time to try and sort out the logjam with the Northern Ireland Protocol to make trade easier. Lord Frost giving a speech in Lisbon, I think, later on today, saying it's not good enough. We've not actually heard what they're going to say yet.
Well, he's giving a speech, so obviously I don't want to preempt that. But I don't see it as the EU giving in or one side giving in. I think there's a recognition on both sides that the protocol needs to work for both communities in Northern Ireland. The whole underpinning of the Good Friday Agreement, which both sides are deeply committed to, is based on the consent of both communities. And I think there's a recognition on both sides that the protocol is not working. And so what Lord Frost will be talking about is very sensible proposals that the British government set out through our command paper as to how we can better ensure that the protocol is fit for the purpose and sustainable in a long-term way.
Is it trade that we're worried about, sausage wars, as it's been used as shorthand in many of the newspapers, or is it the involvement of the European courts, them overseeing the protocols in Northern Ireland, that we're most concerned about as a country?
Well, it's both. I think the governance matters.
Because we were told it was trade wars for a long time, weren't we? And now we were hearing about the European Court.
No, it's both. I think it's both in terms of how trade and businesses are affected, but it's also the governance as well and the imbalance of that. But more fundamentally, it's about both communities viewing the protocol as sustainable in the long term. And I think that's the issue, because that really goes back to what I think shapes the views of both sides. Both sides are committed to the Good Friday Agreement. Both sides want to ensure that that is protected. And we need a protocol that is sustainable in the long term. And that's really what Lord Frost will be addressing today.
And just a quick thought, I know you've got to go. Quite a few supermarkets and food production companies are warning that people shouldn't panic buy, and there are some concerns about what's going to happen ahead of Christmas, and the shelves are going to be empty in supermarkets. I suppose you would reiterate their comments that
I would. And I think people should just remember the start of the pandemic, when our supply chains came under huge strain and they saw the resilience of the UK retail sector. The government is working very closely with industry. We brought Sir Dave Lewis, the former chief exec of Tesco, into the heart of government to liaise with the industry. We're responding to a number of industry requests. And we do have an extremely resilient food sector within the UK. And what happened with petrol was driven by a consumer reaction. There was actually more deliveries than sales going into forecourts. That has stabilised, but we are working very actively with industry, and people like Sir Dave Lewis is helping with that liaison.
Yeah, Prime Minister enjoying a few days away at the moment with his young family. You must be quite envious you've not had a break this year.
Well, it's quite right. The Prime Minister, given that I think all of your viewers, Kay, would recognise the job of Prime Minister is a hugely demanding one. And I think people recognise that it's also important that our leaders, our Prime Minister, is able to get refreshed and come back to the parliamentary term next week. I don't think people will begrudge him that.
No, I'm not saying that. I'm just saying you must be a little tiny bit envious given that you've not had a break.
But I think the demands of a Prime Minister are extremely hard, and it's quite right that he has a break.